Hi, my name is Christina. I'm going to be your nurse today. I'm just going to step over here and wash my hands real quick. Okay, can you verify your name and date of birth for me?
Lauren Powell, 8/21/94.
Okay, and we're just going to do a quick head-to-toe assessment today. It should only take about 15 minutes. Okay, patient appeared healthy when she walked in. Color was healthy. And then I would check her temperature, her blood pressure, and her pulse. And now I'm going to check her level of consciousness and orientation. So can you tell me what day it is?
It's November 25th, 2018.
Okay. Can you tell me where you are?
The hospital.
And can you tell me who the president is? Okay. So patient is awake, alert, and oriented to person, place, and time. And she is a 15 on the Glasgow Coma scale because her eye-opening response is a 4, her verbal response is a 5, and her motor response is a 6. And now I'm going to check her pupils to make sure they are perlite. So at first I'm just going to shine the light into your eyes. Okay? And now you're going to follow the light in the direction that I go using only your eyes. Okay? Patient's pupils are pearl, which means her pupils are equal, round, reactive to light, and accommodating. And now I'm going to check her eyes, ears, and throat for lesions and abrasions. Okay, ears have no lesions or abrasions. Nose is midline with no obstructions. Can you open your mouth for me? Tongue is midline, no lesions or abnormalities in the mouth. And now I'm going to palpate her throat for enlarged lymph nodes and then make sure her trachea is midline. Make sure you tell me if you have any tenderness. Okay. Now I'm going to have you turn your head to the left, and I would displace her trachea and feel it, and then turn your head to the right and displace it and feel it. So she has no enlarged lymph nodes and her trachea is midline. And now I'm going to auscultate her breath sounds. So each time I move my stethoscope, I'm going to have you take a breath in and a breath out. Make sure you tell me if I'm moving too fast and you start to feel lightheaded. And I'm going to move right to the back. Okay, her breath sounds are clear with no signs of adventitious sounds. And then I would check her pulses, which I would check her peripheral pulses first, which would be her radial, brachial, carotid, femoral, dorsalis pedis, and posterior tibialis. But for the video, I'm just going to do her radial. pulse is 80 and her breath sounds would be 16. Her respiration rate is 16, sorry. And then I would check her apical pulse, which would be mid-clavicular, and it would either be in the 4th intercostal space or the 5th intercostal space. And now I'm going to check her heart sounds. And again, her point of maximum impulse would be the mid-clavicular 4th to 5th intercostal space. Okay, so now I'm going to have you lay down. How often do you have a bowel movement?
Twice a day.
Okay, when was your last one?
This morning.
And what is the color and consistency?
Regular brown.
Okay, so now I would just inspect her abdomen for color, contour, and just shape to make sure nothing's distended or just abnormal. And then now I'm going to listen to her bowel sounds. I would normally listen in each quadrant for 2 minutes, starting with the right lower quadrant, then the right upper quadrant, left upper quadrant, and left lower quadrant. But for the video, I'm just going to do like 5 seconds. Okay, now I would palpate for rigidity, masses, or tenderness. Do you have any tenderness in your stomach right now?
Okay. Just tickles. No tenderness.
Okay. Alright, so now I'm going to assess her strength. First of all, when she walked in, her gait was even. And do you use any orthopedics, like any shoe inserts or anything like that? Okay, do you have any trouble doing daily activities, like getting out of bed, using the restroom? Okay, I'm going to have you squeeze my 2 fingers. Alright, I'm going to have you push against my hands, pull against my hands. Okay, I'm going to have you push against my hands and pull against my hands. Okay, and then I would test sensory by doing a sharp dull test with a paper clip. And then I would also test for sensation by doing a cotton wisp on her face and down her legs and just having her tell me when she feels it. Okay? So then I would just palpate her joints for pain and swelling if she had any. Do you have any pain or swelling in any of your joints, like your fingers, your neck, back? Okay, so there were no abnormal findings in her head-to-toe assessment in